Welcome back to Mr. Speaker Sir, right here on MCTV Multicultural Television. I am your host, Kieron Joseph Samaroo, and we are still in the conversations about the workforces throughout the country. We were speaking a while about the teaching workforce or the teaching service, and now we'll jump into another issue that seems to be affecting the workforce across the country, regardless of which industry they are in, regardless of if they're in the private sector or the public sector, and that is the issue of the jab. And we're speaking about the COVID-19 vaccine and whether or not that vaccine should be made mandatory. Now, very recently, we had a clip from the president of the Industrial Court. She made several pronouncements on the issue of mandatory jabs. That clip was featured on our news. And let's take in a bit of that clip now to hear what the president of the Industrial Court had to say. But before we do that, we do have with us somebody who can shed a very interesting perspective. He is the Secretary General of the Joint Trade Union Movement, JTUM. We'll want to welcome at this point in time to Mr. Speaker, sir, Mr. Ozzi Warwick. Good morning to you, Mr. Warwick.
Good morning to you, Mr. Speaker, Kieron.
Good morning to you. Thank you very much for being so gracious with your time this morning.
No problem. I think it's an important enough issue to really spend some time discussing it and, unpacking a little bit more the presentation of Her Honor, Deborah Thomas Felix, because I think that presentation was a very important and powerful address, which sought to clarify a number of issues that may be uncertain in the minds of employers as well as workers. So I really look forward to having this time with you this morning to bring some clarity and to unpack and to go into a little more details, our position as it relates to mandatory vaccination at the workplace.
Well, let's get straight into it, Mr. Warwick. What is the position of JTUM with respect to mandatory vaccination, and how does your position align or not align itself with the utterances of the President of the Industrial Court?
Okay, I would like to start off putting forward a fundamental point that the President of the Court made, in which she gave a context for her explanation as to why mandatory vaccination in the workplace unilaterally imposing a change in your terms and conditions of work. She set the tone for that by stating very clearly that in a situation of a crisis, international labor standards, good industrial relations, principles and practices, the rule of law, that is not thrown out of the window. That is still there. In fact, what she stated was that more than ever in a situation of a crisis, you need adherence to international labor standards. You need adherence to the rule of law. You need strict adherence to the principles and practice of good industrial relations. And that is so fundamental because sometimes we lose sight of what are some of the international instruments and the international framework that enable persons to function within a society with a certain level of dignity. And that notwithstanding the pandemic, she was making the clear point that now more than ever is when you need to adhere to international labor standards, the good industrial relations practices and principles, as well as the rule of law to safeguard the interests of all. Now, having said that, I want to state very categorical that the entire trade union movement, all three federations, which are the Joint Trade Union Movement, National Trade Union Center, and the Federation of Independent Trade Unions and NGOs, fully endorse the statement of Her Honor, Deborah Thomas Felix. Because one of the things she said is that the main issue as she saw it, and we agree with that, is whether a mandatory COVID-19 vaccination policy can indeed introduce new term of employment to existing employees without discussion and consultation. And there is where we share that view. In fact, we stated that very early on in this, when the pandemic actually just began last year, that what is required is serious, genuine consultation and discussion with workers, with the recognized majority union where there is one, so that we are able to come up with a vaccination policy that ensures the adherence to international labor standards as well as to good industrial relations and principles and practice. So we fully endorse that view. In addition, she went on to state that there's no express provision in the Industrial Relations Act. That is the legislation that guide industrial relations in Trinidad and Tobago as it relates to vaccination policies being introduced in the workplace as new terms and conditions of employment. Because that is the point, Kieron. The idea of mandatory vaccination, what in fact it does, it changes your terms and conditions and international labor standards, good industrial relations principles and practice, as well as the IRA require the employer to consult and have a discussion with either the recognized majority union where there is one or with the workers.
Let's take up in there, Mr. Warwick, because one of the things that you refer to out of the president's speech was the question of the rule of law. It is very interesting to note that thus far there is no legal guidance or no law or no indication from the Ministry of Labor or from the government as a whole on the legal requirement that workers be vaccinated. And is it therefore that in the absence of a legal requirement, you have employers trying to make do?
In the absence of a national leadership, let's just start there. In the absence of national leadership, in the absence of a national policy on vaccination at the workplace, in the absence of legislation that makes it mandatory nationally, you are seeing employers arbitrarily imposing vaccination policies. Now, I want to say something about the lack of a national policy on vaccination, because the trade union movement, along with employers and the government, sat in the Industrial Relations Advisory Committee to trash out what could be a national vaccination policy. We are yet to hear from the Minister of Labor. If you recall, he said maybe months ago, it coming every week. And that is one of the problems that we are having with this government. So you had a process whereby workers' organizations, employers' organizations, and governments sat, trash out some sort of draft national policy, and then we dead silence. And in the absence of that, of course, employers are going to arbitrarily attempt to impose vaccination policies. And it has also to do with the fact that they're just not aware that what they are doing is in fact unilaterally altering the terms and conditions of employment. And this is why the president was at pains to explain the number of industrial relations offenses that is before the court. And so she sought to bring clarity and to advise employers that you cannot unilaterally impose mandatory vaccination at the workplace. And the trade union movement supports that because that has been our position. Okay, and we endorse that.
Mr. Warwick, we hear you with the point that employers cannot impose it on a mandatory basis. We hear the president of the industrial court saying the same, articulating the same position. But what if there's an employee who may have to have their contract renewed, and as part of the contract, or the renewal of the contract, the employer slips in there the requirement to be vaccinated on a mandatory basis? Is there some recourse or some mechanism for recourse or some agency that is now responsible for dealing with these issues as they emerge?
These issues will emerge, and of course it will be on a case-by-case basis. And there is a process within the Industrial Relations Act in terms of the grievance procedure by which if a worker realizes that the employer is indeed changing their terms and conditions, even if it's a renewal of a contract, because the terms and conditions will be changed from the original contract, then that worker has a grievance and would be able to access the industrial court through a trade union. So there is a recourse for workers who are whose contracts, whose terms and conditions are being unilaterally changed. Now, I want to also bring in another fundamental point, and it has to do with why are we here and why is this major discussion as to mandatory or not. There's a reason for that, and it has to do with the level of vaccine hesitancy, or as we would like to call it, vaccine cautious. All right, people are vaccine cautious. Now, it has also a lot to do with the government's campaign in general. Let me explain, Carol. When the government claimed that vaccinate to operate, what they in fact did was they took the health part of it out of the issue of vaccination. So vaccination now simply become a precondition to go back to work, or vaccinate to educate. It became a precondition to get education. So the person who's hearing this message is thinking that this now has nothing to do with my health and protecting myself. This has to do with either the employer or the government telling me that in order for me to go back to work, I have to be vaccinated. In order for my children to go to school, they have to be vaccinated. And that will raise suspicion. That will raise a red flag for any person, because now I'm feeling as though my choice is being taken away from me, not because it will ensure the protection of my health, but simply because it will enable me to go back to work. It is now a precondition to work, and that is a fundamental violation of international labor standards.
But Mr. Warwick, how do you balance the view that the individual's right to vaccinate is just as important, or not just as important, but also important as the employer's right to protect their investments? When an employer or a company or corporation puts out money and they form a business, a restaurant, an enterprise, whatever it is, they put out monies, and when people are sick because of COVID-19, it may create, number one, an issue with their human resource base as more people are exposed to the virus. That may spiral into a question of costs and what the company does not get out of their human resources for a period of time. And it may affect the company's reputation, depending on the extent of the infection or the extent of injury that is there. So how do you view the discussion of the individual's right to vaccinate, the employee, and the employer's right to protect their investment by insisting on mandatory vaccinations?
Well, I would say that it is a balance between the individual right to choose what goes into my body and the individual right to protect myself and my family, as well as the collective right to have a safe workplace. Now, how do you strike that balance? You cannot strike a balance, Kieron, through force, threats, intimidation, and bullying. You strike a balance, as you do in life, through dialogue, discussions, consultations, listening to the different sides, developing alternative protocols. In other words, one of the things or one of the mistakes we could make, including employers, is to say, well, vaccine now become the only form of protection. And then you lapse in the other areas where of protection, whether it's sanitizing the workplace, washing your hands regularly, or social distancing. The vaccine will not help you if you violate all these other public health protection measures. So our point is you are able to get that balance through dialogue, discussion, consultations, and through addressing, Kieron, people's real fears. Because there are real fears. And so you are better able to strike that balance by providing education, through persuasion, getting medical personnel to speak to your staff, speak to the workers. In other words, you treat every single worker with a certain level of respect and dignity so that they all can come on board to ensure that the workplace remains safe and therefore operational. Safe for those who choose to be vaccinated and those who choose not to be. And on the question of choosing not to be, as I said earlier, a lot of it has to do with a lot of misinformation. So rather than spending time bullying persons, it makes more sense to provide continual education. You must know, I'm sure you have friends, you have family members who were hesitant at first, but then over time, as they learn a little bit more, as they become more comfortable and they realize that maybe the risk involved here will be far more for me, my health, and my family if I don't take the vaccine, and they came along in due course. So I suggest, at least the trade union movement position is that that approach is a much more humane approach. And let me also add, Kieron, we are suggesting as a trade union movement that you take a risk assessment approach, meaning that you take it site by site, location by location, workplace by workplace, and do a risk assessment to determine how do we reduce the level of risk, where vaccination is one of several options, or rather, one of the options that meets the minimum criteria as set out in the Occupational Safety and Health Act.
It's interesting, Mr. Warwick, that you have raised the question of other protocols that must be put into place, because it seems as though a lot of the conversation is on vaccines and vaccinations. What is your view on the implementation of other anti-COVID protocols, whether it is the social distancing in the workplace, whether it is the sanitization of workspaces, whether it is the enforcement of contact tracing? Do you believe that we have missed the boat, so to speak, on implementing these other controls and safety measures while discussing the issue of vaccines?
Yes, and that is what our fear is, that there's such a focus on vaccines that even employers will feel, well, you know what, let me just impose vaccine on everybody, but all the other protective measures, they ease up on that. And here's what will happen in a situation like that. The vaccine doesn't stop the spread. In other words, if you're vaccinated, you can still transmit it, become infected. What it does, it gives your body an added level of protection so you don't get ill and that you're not hospitalized. And if therefore you simply impose vaccination, but then you ease up on the other measures, we don't know what will happen if the virus continues in the environment, even amongst the vaccinated. At first, there may be little effect whatsoever, but if it just continues within that environment, we do not know what will be the final outcome, what could be the repercussions of that. Therefore, our position is we have to stick to the fundamentals. We have to stop the spread. And one of the ways, or several ways in which we stop the spread, is to follow the existing public health protocols of social distancing, hand sanitizing, and wearing of masks. Because we see people who may feel, well, I am vaccinated, I cannot wear my mask. We think that is not going to be helpful.
Mr. Warwick, even as we approach 11 o'clock, it would be remiss of me to not ask you your views on the state of industrial relations in Trinidad and Tobago. We saw very recently where Exxon, TT, they have decided to migrate to Guyana, and of course there would be some level of impact for the workers there. We're hearing all types of comments about what's going on at the port of Spain, imminent changes or imminent decisions to be made at WASA. What are some of your general thoughts on the state of industrial relations in Trinidad and Tobago at this point in time?
Well, the fact that the trade union movement and the three federations had to depart the National Tripartite Advisory Council
yes,
is very good evidence of a complete failure by the government to really utilize a mechanism for bringing stakeholders together to ensure industrial relations peace and stability. What the government is seeking to do, Kieron, is drive the country into a model of governance, a type of state whereby you have limited or restricted public ownership of key services that a government is supposed to provide to its people. We call it the life support infrastructure. So what we are seeing is the government attempt to completely remove the subsidies. Which will increase fuel prices, and therefore the cost of living is going to go up. You see the prices in the supermarket and prices of household items and the hardware, all of that going up with no intervention from the state, no intervention from the government. Privatization of the Port of Spain, restructuring at WASA. There's also Lake Asphalt, which is another one that is sort of under the current. We have TSTT, with the retrenchment of some 600 workers being threatened at TSTT. There is a complete lack of vision as to how do we ensure that in this crisis time, especially as it relates to COVID, that we are able to have people sustain their jobs. Because if you don't have demand, Kieron, what are you going to do with all the supply? You're going to end up in you're going to end up in further crisis. Look at the situation with gas, and I mean I can go on and on. It is a complete debacle. What happened with NGC, and they still have a refinery that is offline. And I mean, the list can go on and on. And at the end of the day, people's material conditions have not changed. People's material conditions are worsening. So the state, I want to make that link between the state of industrial relations in Trinidad and Tobago and the material conditions of ordinary working people. Because the state of industrial relations is at its lowest, what we find, people's material conditions have in fact worsened over the last few years. And with COVID-19, that have exacerbated the burden of economic adjustment on working people. And let me just add, on top of all of that, Kieron, introduction of property tax.
It seems as though we will have to have a part 2 discussion with you, Mr. Warwick, because we've just started to scratch the surface on a number of industrial issues, and most certainly the question of property tax is one of those that will affect the cost of living of the working class. But we do want to thank you, Mr. Sure. Go ahead.
Yeah, just as I just to make a closing statement, all these issues are all related, whether it's the COVID-19, whether it's this unilateral changing of people's terms and conditions, the energy crisis, and so on. At the end, Kieron, Mr. Speaker, it's about what kind of society do we want to construct? What kind of society do we want to build? And how do we, coming out of this moment of crisis, reorganize our society where people's material conditions, the reproduction of their daily lives, is one that is with dignity, Mr. Speaker. So I want to end with that statement that we all must have this, make a contribution to building a different type of society where people is at the center, not profit, people.
And on that note, Mr. General Secretary, we want to thank you. That, of course, Mr. Ozzi Warwick, the General Secretary of the Joint Trade Union Movement, giving us his views on a range of issues from the mandatory jab to the state of industrial relations in Trinidad and Tobago. Thank you again, Mr. Warwick, for your time.
Thank you very much for having me.